I'm understanding that symptoms worsen over time. Many people who are affected with symptoms in respiratory are cared for by primary care physicians. What is your recommendation if someone's experiencing symptoms like you've described and they're concerned? What should they do and who should they see?
So if you think you might have NTM lung disease, or that a loved one might have it, or if you're having chronic pulmonary symptoms, the first thing to do is to go to your primary care doctor and ask them to refer you to a specialist in pulmonary disease, someone who knows the lung and can treat lung infections. And there may be pulmonologists in your area that are also specialists in NTM lung disease and things like bronchiectasis. In certain parts of the country, infectious disease specialists may be able to treat NTM lung disease.
Daria, what kind of doctors did you see when you developed these symptoms?
Well, I initially saw my primary care physician who referred me to a pulmonologist. I ended up seeing 4 pulmonologists in all, and Dr. Drizo Harris was one of them. And since I've seen her, she referred me to a gastroenterologist who specializes in treating people with GERD, and he was able to narrow in on medications that would help with the GERD symptoms I was experiencing. Even if you've received a diagnosis, it's important that you continue discussions with your doctors in case you have ongoing symptoms or your CAT scans are changing.
This is a chronic illness. It requires, as you've both said, real lifestyle changes. As a person who's a patient with this chronic illness, tell us a little bit about how you communicate to your physician your concerns and how you've learned to manage your illness.
Okay, well, when I first heard I had NTM lung disease and I reviewed the abnormal CAT scan from my first one, I had a lot of concern. I was a little taken back by it, and I had a lot of questions. A few of the questions I asked were, how did I get the disease? Is the disease hereditary? How I knew I was going to be looking at possible CAT scans in the future, and I wanted to know how frequently they might be done, because I was concerned with some of the radiation that you hear about, but I was assured that the radiation is low dose. My biggest advice to people and to our viewers is to be your own advocate. The disease is often misdiagnosed or not diagnosed at all. So you have to be proactive. You have to sit down, talk with your doctor. You need to ask a lot of questions and take notes. If you feel you need somebody with you, have somebody go with you. It's a disease that's going to be ongoing. You will have periods where you feel worse, and it's important you keep an ongoing relationship with your doctor. I sought out 3 different opinions in my situation until I got a final diagnosis. Probably about 3 years ago, I decided I wanted to start seeing somebody closer to home. So I did some research online, and I found out that NYU had specialists who treat NTM lung disease and treat bronchiectasis, which led me to seeing Dr. Drizo Harris. So I've now been seeing her since 2016.
Dr. Drizo Harris, what would be your recommendation to people that are watching us today in terms of learning to manage?
So my recommendation is to talk to your current physician. If you're having chronic pulmonary symptoms, or if you feel like you might have NTM lung disease, you need to be referred to a specialist who knows about NTM lung disease. So my recommendation is to ask your primary care doctor to refer you to a pulmonologist. And if in your area there may be pulmonologists who specialize in NTM lung disease, then you might consider going to see one of them. So that's extremely important, that you're dealing with someone who knows about NTM lung disease, because it is a rare disease.
Right.